I'm Dr. Carlson at North Texas Plastic Surgery. Today we'll be discussing several different male procedures that we perform here, starting off with gynecomastia. Gynecomastia is a condition where there's an abnormal amount of breast tissue present. This can be something that dates from puberty all the way to adulthood. It can be something that develops later in life. Regardless of what causes it, there's several different ways that we can go about treating it. From a surgical standpoint, there's a few different factors that we need to take into consideration in determining how to treat the gynecomastia. The first is the type of tissue present. For the breast tissue, there's normal breast tissue and then there's glandular breast tissue. Normal fatty breast tissue can be treated with liposuction. Glandular breast tissue is much tougher and is not going to be able to be removed with a liposuction cannula, so we have to do what's called direct excision. Now, depending on how much tissue is present on top of that, namely the chest or breast skin, will also determine if we're able to just do liposuction or direct excision. Sometimes there's excess skin that needs to actually be removed surgically as well. The best way to determine how to treat it is an actual physical exam performed by your plastic surgeon. If there is just fatty breast tissue present, we can make very tiny incisions and remove that fatty breast tissue with liposuction. If there's a glandular component, then we will have to make at least one small incision to remove that breast tissue through the incision. Finally, if there's excess skin present along with the fatty and/or glandular breast tissue, we might have to remove some skin. In terms of incision length, that's typically done at what we call the inframammary fold, or where the breast comes off of the chest wall, to best conceal that incision for you. Again, the best way to determine which treatment option is best for you would be a physical exam performed by your surgeon so that you can come up with a treatment plan together to best tackle this problem. Patients will usually ask about the recovery process from their surgery for gynecomastia. Some of that will depend on how it's treated, whether it's the liposuction and/or glandular excision, but what I typically tell patients is that they can expect to return to doing cardio at about 3 weeks after surgery, and then more vigorous exercise closer to about 6 weeks from surgery. Another factor that will play into that is whether or not you have a drain present. Whether or not a drain is left will depend on how much space is left between your pectoralis muscle and the skin. That's usually an intraoperative decision made by the plastic surgeon at the time of the surgery, but I would say that it's usually done on a case-by-case basis. After surgery, I apply a foam padding atop the chest with a vest to help keep that compression in place. That really helps reduce the amount of swelling that the patient experiences and really enhances their recovery so they can get back to activity much quicker. A common question that I get about gynecomastia is what causes it. Now, there's a laundry list of things that actually cause it. It can be due to medications, it can be a hormonal imbalance, it could be actually an endocrine issue. If and when we determine what causes it, if we remove that cause and that gynecomastia tissue is still present, we should still talk about how we go about treating it. It's a very common condition. A lot of men have it. Some of it is more noticeable than others, but it is a much more common condition than you would expect. Another common procedure that we perform for our male patients is a tummy tuck. Now, our goal with performing a male tummy tuck is giving that nice athletic triangular shape back to the trunk. It's typically combined with liposuction all the way around the trunk. That allows us to really emphasize those back muscles and also start to really show those six-pack muscles underneath. The length of the incision for a tummy tuck for a male will really depend on how much excess skin and subcutaneous tissue is present. The standard tummy tuck will run from about the hip bone on one side to the hip bone on the other. If there's excess tissue on the flank area or the love handle area, I would recommend extending that incision to the back. That will really allow me to give you a nice shape to the hip area to really bring in the waist and give you that nice triangular shape. During the tummy tuck, I'll check to see if there's any separation between the six-pack muscles. If there is, that's a condition what we call rectus diastasis, or separation of those six-pack muscles. It's a little less common in male patients just because there aren't pregnancies or conditions that cause the inside of the abdomen to put tension on that area. But if there is separation, what I'll do is bring them back together with a suture so that you have that nice six-pack look to the abdomen at the end of the surgery. With regards to the recovery process from a tummy tuck, it will really depend on the amount of plication that is done, the amount of liposuction that is done, and how much skin is removed. What I typically tell patients is that they'll be able to return to doing cardio at about 3 weeks after surgery and more vigorous exercise about 6 weeks after surgery. Each patient is a little bit different, and since we do the actual plication sometimes, that area will need to stretch out a little bit after surgery. Those patients might have a slightly slower recovery, but again, that's to bring the waist in and give you a nice shape to the torso. Now, we talked about returning to activity, but another thing that patients will experience after a tummy tuck is swelling. For you to wake up in the morning and forget that you had surgery, that will take about 3 to 4 months after surgery. That's because of the residual swelling that just takes time to resolve. But that being said, you're going to be up and walking the same day as surgery, so the recovery process is just a gradual progression to that point. When I perform a tummy tuck, I leave drains in place to help get the fluid out from underneath the skin. We create a lot of space between the skin and the muscle, and if we didn't have drains in place, that fluid would build up, and it does so quickly your body's not able to recycle it. The drains are a quick way to help get the fluid out, and we remove the drains as soon as possible after surgery. I would say on average, patients typically will have their second drain removed at about 2 to 3 weeks after surgery. We had talked about the swelling that patients typically experience after having liposuction and a tummy tuck performed. Now, to help with that, we have a compression garment that you will wear after surgery for a total of about 6 weeks after surgery. On top of that compression foam is a garment that spans from the arms down to the thighs. That's to really keep that garment in place and reduce the amount of swelling that the patient experiences. Some patients find the compression garment somewhat tedious to wear and also somewhat hot, particularly in our Texas summers. Now, to help with that, I tell them that they can stop wearing it at about 6 weeks after surgery. After that 6-week mark, I tell them that they can wear it if it gives them some compression and helps with the swelling, but after that 6-week mark, usually most of the swelling has subsided to the point that they are comfortable without wearing it. If you have any questions about these or any other procedures that we perform for our male patients, give us a call or check out our website at the link below.